Heart attack symptoms. If the blood supply of the heart is substantially restricted or impeded, a heart attack will consequently take place. Signs and symptoms. The signs and symptoms of a heart attack can vary. In some cases, the symptoms are not severe. The symptoms of others are quite severe. Some folks do not exhibit any symptoms. These are typical symptoms of a heart attack. People may think of chest pain as a classic indication of a heart attack. On the other hand, a heart attack tends to impact not only the heart but also the rest of the body. The symptoms of a heart attack can manifest themselves in a variety of ways depending on the age and gender of the individual. If a person is experiencing chest pain, discomfort, or shortness of breath that is getting worse, they need to consult the healthcare expert. This is especially the case if it takes place during periods of peace. The majority of heart attacks are characterized by several distinct symptoms, which, as stated by the Centers for Disease Control and Prevention, CDC, includes pain in the chest. Heart attacks are characterized by pain or discomfort that is often felt in the middle or left side of the chest. There is a possibility that it will feel like a heavy, tight squeezing, fullness, or other uncomfortable pressure. On a less frequent basis, it may take the form of severe pain. Inability to breathe easily. Chest pain is typically accompanied by this symptom. On the other hand, symptoms of shortness of breath may appear before any chest discomfort appears. Pain in the upper body. A person can experience pain or discomfort in one or both of their arms, most commonly the left arm, which can manifest itself in the shoulders. Movement does not often make this pain feel worse, unlike the discomfort that is associated with musculoskeletal conditions or arthritis. It is also possible to experience pain in the back, jaw, or neck. Being dizzy and lightheaded. A person could experience feelings of weakness, fainting, or even break out in a cold sweat. Symptoms of a heart attack in ladies. Females can experience heart attack symptoms differently, with some appearing less obvious or unrelated to heart problems. Here's a list of frequent symptoms of a heart attack that can occur in females that may or may not be accompanied by chest pain. There is a sudden onset of weakness, extreme shortness of breath, nausea, indigestion, or other digestive problems, aches and pains across the entire body, an overall feeling of being poorly, and discomfort in the back or upper torso. Because chest pain is usually associated with heart attacks, females may misinterpret their symptoms and postpone seeking medical attention as a result. It is essential for individuals, particularly women, to be able to identify signs of a heart attack that may not be normal and to seek quick medical attention when it is determined that action is required. Symptoms of a heart attack in older people. People who are 65 years old or older have a higher risk of experiencing a heart attack, stroke, or developing heart disease, as stated by the National Institute on Aging, NIA, which is a trusted source. A silent or asymptomatic heart attack may also be more likely to occur in elderly persons who have diabetes or high blood pressure, according to a reliable source. It is possible for a person to have a silent heart attack without experiencing any symptoms and to feel pretty good, except for experiencing unusual tiredness or shortness of breath. In addition, they might exhibit one or more of the symptoms that are associated with heart attacks in females. Occasionally, heart attacks occur all of a sudden. However, many individuals exhibit warning signs and symptoms hours, days, or even weeks in advance of the event. If you experience chest pain or pressure, also known as angina, that persists and does not go away even after you rest, this could be an early warning sign. Angina is brought on by a momentary reduction in the amount of blood that flows to the heart. When to make an appointment with a physician, immediately seek medical attention if you believe you are experiencing a heart attack. Do these steps. Make a call for immediate medical assistance. If you believe you are experiencing a heart attack, you should immediately dial the emergency number in your area. It is recommended that you have someone transport you to the nearest hospital if you do not have access to emergency medical care. You should only drive yourself if there are no other choices available. Nitroglycerin should be taken only if it has been prescribed to you by a medical professional. As you wait for assistance in an emergency, take it as directed. If it is recommended, take some aspirin. By keeping blood from clotting, taking aspirin during a heart attack may lessen the amount of damage done to the heart. The drug aspirin may interact with other medications. Aspirin should not be taken unless specifically instructed to do so by your healthcare physician or emergency medical staff. Make sure to call 911 as soon as possible and take an aspirin. Call for assistance in an emergency first. Taking action if you observe someone who appears to be having a heart attack. If you are concerned that someone is having a heart attack and they are unconscious, the first thing you should do is contact 911 or the emergency number in your area. After that, make sure the individual is breathing and that they have a pulse. To begin cardiopulmonary resuscitation, CPR, you should wait until the individual is not breathing or if you are unable to locate a pulse before beginning the procedure. CPR using only your hands should be performed if you have no prior training in the technique. Approximately 100 to 120 compressions per minute are required to be applied to the chest of the individual. Once you have completed 30 chest compressions and are confident in your abilities to perform cardiopulmonary resuscitation (CPR), proceed to give 2 rescue breaths. The majority of heart attacks are brought on by coronary artery disease. Coronary artery disease is characterized by the obstruction of one or more of the coronary arteries of the heart. The majority of the time, this is because of deposits known as plaques that contain cholesterol. Plaques can restrict the arteries, which in turn reduces the amount of blood that flows to the heart. The formation of a blood clot in the heart might be brought on by the rupture of a plaque. An artery in the heart, known as a coronary artery, can become completely or partially blocked, which can lead to a heart attack. Whether or not an electrocardiogram, ECG, or EKG reveals certain changes, ST elevation, that necessitate immediate invasive treatment is one method that can be utilized to categorize heart attacks. The results of an electrocardiogram, ECG, may be used by your healthcare physician to characterize the variety of heart attacks that you are experiencing. A sudden full blockage of a medium or large heart artery is typically indicative of an ST elevation myocardial infarction, STDMI, which is an electrical discharge from the heart. The presence of a partial blockage is frequently indicative of a non-ST elevation myocardial infarction, NSTMI, that has occurred. On the other hand, a total blockage can occur in some patients who have developed a non-ST elevation myocardial infarction, NSTMI. Remember, blockages in the arteries are not the cause of every single heart attack. Thanks for watching. Kindly like and subscribe for more videos. In the comments section below, please tell me how many you discovered. Don't forget to check out our other informative videos on the channel.